I got a question about leflunomide, so let's get into it. We'll start with the basics first, and then after that, we'll maybe talk about some of the more unusual things that happen with this medication. So first of all, just like methotrexate, this is a disease-modifying agent that we use commonly in the treatment of rheumatoid arthritis. It is once a day. Usually start at 10 milligrams a day, check labs in about 4 weeks. If everything looks okay, then I go up to 20 milligrams a day. So right off the bat, you can tell that there's some lab monitoring involved. And yes, liver, kidney, blood counts at regular intervals to make sure those things stay okay. And what are the big things I need patients to know? Well, besides the labs, of course, watch your alcohol consumption, again, liver, hair thinning. So, you may notice a little extra hair in your brush, and that can be distressing to some patients. So I do like them to know. The big one is GI side effects, nausea, abdominal discomfort, and so on. Typically gets better, but again, you need to let your doctor know. The other big one is immune suppression. These are immune suppressive medications. So if you get sick, you get put on antibiotics, you feel like you're coming down with something, let me know so then I can make any adjustments that I think are necessary. You can't take it if you're pregnant. You can't take it if you're nursing. And more importantly, if you are taking this medication and plan to get pregnant, you need to discuss this with your rheumatologist because we have a whole protocol to get the medication out of your body before you even start trying to conceive. What about some of the more unusual or uncommon side effects? Well, one that's actually not that uncommon is blood pressure. So patients will notice a rise in blood pressure or have symptoms related to elevated blood pressure once they start the medication. And I definitely want to know that. The other weird one is peripheral neuropathy, which is like numbness and tingling of the hands and feet. Again, gets better once we hold the medication. How long does it take for effect? 6 to 12 weeks from when we start the medication before you start noticing an improvement. So let me know if this answered your questions, and if you have any other questions, comments, concerns, drop them in the comments below. Also, let me know what your experience has been with leflunomide if you've taken it.